to a story that's come out of the UK. Weight loss and diabetes drugs like Mounjaro and Ozempic, they've proliferated in the past few years, really offering life-changing support to so many people. And for some, a quick fix to drop a few pounds. But for a small number, they have proven fatal. These meds have recently been linked to the death of 5 people in Scotland. That's according to their Medicines and Healthcare Regulatory Agency. Nurse Susan McGowan, who is 58 years old, also became the first person in the UK whose death was directly linked to a weight loss jab. That was last September. She experienced organ failure, septic shock, and pancreatitis after taking 2 doses of the medications. Now, professionals are warning that these drugs need to be taken properly with the right support as well. And joining us now to discuss this is Dr. Nazim AL Rifai, who is a specialist of general surgery and a bariatric surgeon at Zahra Hospital in Dubai. Dr. Nazim, thanks for joining us on the phone.
Thank you so much. How are you?
I'm good, thank you. Now, Dr. Nazim, can I first get your reaction to this story? The reason we're talking about this is because of a recent report from Scotland about how these weight loss drugs, these GLP-1 jabs, have been directly linked to 5 deaths.
In fact, it's like any medicine. It is one of the complications of this medicine. It could have some minor complications. Sometimes it is like reaching to the middle or more complicated, or serious complications like acute pancreatitis. But the idea is that it's over highlighted. It is this medicine, if you read the effect of obesity over people, and if you read the statistics of the health organizations all over the world, the death because of obesity over in 2019, can you expect the number? It is more than 2 million person or people died because of obesity. So if we have an accident of 1 death or 5 or 7, so it is one of the very accepted. Of course, I'm not supporting the random use of any medicine, including paracetamol, because there are even paracetamol or ibuprofen, which is daily use medicine. It can cause renal failure. It can cause hair loss. But generally speaking, there are serious complications of these medications like Mounjaro or Wegovy or all the weight loss injections. But the overall experience of the medical system, it's very good. It's treating a very serious disease.
And I think part of the issue is, and I take your point, that all medicines have risks associated with them, absolutely all, but we have to take the big picture into account. When we compare the risks of obesity versus the potential risks of taking these drugs, for example, I think some of the challenges, though, with these GLP-1s is that it's not even always people using it for obesity. Sometimes it's people who just have a few extra pounds on them, occasionally people using them quite casually. So what do people need to know as lay people who are considering using a GLP-1 for whichever reason, whether that is for diabetes, obesity management, or for weight loss reasons? What do people need to know about how GLP-1s work?
See, the idea of this injections, all of the weight loss medicine, it is, first of all, people think that this medicine increases the metabolism, which is not the right idea. This medicine does not have any relation with the metabolism. It just makes some change of the mechanics of the stomach. So the movements or the activity of the stomach regarding pushing the food down is less and less with using of this medicine. That's why the food will stay in the stomach for a longer period of time, and the people feel they are full, they cannot eat. This is the only mechanism of this medicine or these medicines. Now, related to the weight loss, the thing we face every single day, that people take this medicine by themselves. There is no consultation. They didn't see the medical professional for this. They just think. And this is what I blame the company that they make this medicine very easy for the people. The injection is it's really very simple. Anybody can put it and inject it. So it's easy for anyone to get it and use it. And here we find a lot of problem. Why? Because sometimes we use, if you are talking about obese people, by default they have they have other medical problem. So when you take a medicine on unhealthy people, you should expect complications. That's why we should make a baseline blood test, baseline X-rays, just to know that we are giving this medicine in a safe way. In case we face any complication, we can just manage it.
And
Personally, I am one of the first physician in the whole country. I prescribe this medicine. Maybe in the first week with the medicine come to the market, I prescribe it. But I did not face any serious case in my practice, which is not, I cannot say this is like evidence-based medicine by personal experience. But we should be just take care when we are dealing with obese people, because even when we are doing surgeries, we screen the patient from head to toe. We did everything just to be sure that our surgery will be safe on those obese people who have more high risk for any single thing we do for them.
Right. Dr. Nazim, you mentioned there that some people are just taking these medications without the support of a healthcare professional. I thought these were all prescription-based. How are people getting their hands on these drugs without having them prescribed?
Nowadays, this is, I don't know, I cannot say this is a big game or a big thing, I don't understand, but we daily and in our meeting with the companies, with everybody, just make it a regulated medicine, some kind of, but it is not happening. It is in the market. It is sometimes in the black market. They brought it from outside, from everywhere. Some people they use they brought 5 boxes. They use 2. They have 3. They give them to their friends. I have this. This is a gift. Even I know a lot of people. I took this injection. My friend sent it to me from this and this, and sometimes even I have two friends. Both of them are using the same injection, the same thing. One is really losing a good amount of weight. It's the expected amount of weight. The other one doesn't lose anything. And he told me, Nazim, I'm not losing. This medicine is not good for me. It doesn't fit me. I told him, no, this medicine is nothing. It's not stored in the proper way. I cannot say it is the only thing. You're a friend. They are working in the same place. They take the same medicine, the same injection, the same. So it is easy to be the access to this medicine is easy. It is all over the country here. It's all over the world. They can brought it from outside, and it is easy to be injected. So it's available, like anything. But usually, for example, in our hospital, Zahra Hospital, we know they cannot sell this medicine on counter. You should have a prescription, registration. It should be written by a doctor or by a physician. This is really we need time to understand this and prevent it.
In the rare cases that are fatal or we do see serious complications, what are the main reasons to have a bad reaction? What is the most common type of issue this can cause for people?
See, this is a very important question. Let me just talk about the people who are obese and healthy. Like he's obese, just obese. He doesn't have anemia. He doesn't have a renal failure. He doesn't have a liver disease. I'm talking about a normal obese people. They are taking the medicine. One of the major problems, the medicine is affecting the GI system, which is merely the motility of the stomach. So sometimes we have a very mild complication. Usually I tell my patient you will have pregnancy symptoms: nausea, vomiting, abstention, diarrhea, constipation. Every single one of them could be severe, leading, for example, vomiting could lead to dehydration. Diarrhea is the same thing, but a lot of time, which is reported, even in this case you are talking about in your report, is sometimes we have acute pancreatitis. And the acute pancreatitis is, even in medicine, which is not related to those medicine, we have acute pancreatitis, which is mild, severe pancreatitis. A lot of people, they just have it as a mild pancreatitis, but some people, they have a severe. I know one of my patients, we admitted him to the ICU because of pancreatitis after Mounjaro. And so those cases can be treated, but the main thing is acute pancreatitis, although we should just mention something. Obese patients are more prone to have acute pancreatitis. Obesity is a disease that could cause itself acute pancreatitis. So some report, they said it is not related to the medicine, it's the disease himself. But Mounjaro and the Wegovy and all the weight loss injection could cause acute pancreatitis, either by direct effects or sometimes by weight loss. People have the tendency to form gallbladder stones, very tiny stones, because of weight loss, and this stone can go to the pancreas and cause acute pancreatitis. So, generally speaking, the major problem is acute pancreatitis, and other thing, all the symptoms could be severe, reaching to the limit that this patient should visit emergency centers. I know, and I have a lot of patients who visited the emergency because of those medicine, because of vomiting, severe abdominal pain, and really, it is sometimes we stop the medicine just after 2 or 3 doses.
And Dr. Nazim, I mean, that really points out, as you were saying, the importance of screenings and going to a medical professional, taking it through a medical professional if you're going to do it, and make sure you have the appropriate screenings done. So thank you so much for joining us today to talk about this subject.
Thank you. Thank you so much.
The voice there of Dr. Nazim AL Rifai, a specialist of general surgery and a bariatric surgeon as well at Al Zahra Hospital in Dubai. We've been talking